Removing an indwelling catheter. Assessment should focus on the following. Assessment helps in determining the patient's need for a certain intervention or procedure. It also provides information about the patient's current status. This procedure is ordered by the physician to terminate urinary catheterization and permit return of client-controlled voiding. Checking the doctor's order will also help in avoiding unnecessary or inappropriate removal of catheter. The assessment data will also be used in comparing with the result of post-assessment for evaluation. Assessing clients' knowledge of catheter removal determines the need for patient education. The equipment or the materials needed are: first, perform hand hygiene. Hand hygiene is always done prior to any procedure or patient interaction. It prevents the transmission of the microorganisms, which can lead to infection or complications that can be detrimental to the patient's health. The next step is to prepare all the materials or equipment needed. So it is very important to prepare all the materials beforehand to ensure that everything is readily available so that there will be no delays and there will be a smooth and easy flow of the procedure. Magandang araw po. Ako po ulit ito, si Student Nurse Alexandra Pineda mula sa Pamantasan ng Lungsod ng Maynila. Okay lang po ba kung tignan ko po? Ano po ang buong pangalan niyo? Araw po ng kapanganakan o birthday? Okay po, salamat po. Miss Smiley, bali may order po kasi si Doc ngayon na pwede na po tanggalin yung sonda niyo po or yung ipinasok po natin na manipis po na tubo para po makatulong po sa pag-ihi niyo po noon. Opo, bali po, ganito ipapaliwanag ko po kung paano po yung mangyari. Pero bago po yun, okay lang po ba kung maupo po ako para mas makapag-usap po tayo ng maayos? Yung pagtatanggal po ng sonda, mabilis lang po na proseso po yun. Bali may tatanggalin lang po muna akong tubig. Then habang hinihila ko po palabas yung manipis po na tubo o yung sonda po, ihinga po kayo ng malalim at mabagal po para po ma-relax yung muscles nyo ay mabilis po natin matanggal yung manipis po na tubo. Opo, sabihin ko naman po kayo kapag hihinga na po kayo ng malalim and aalalayan ko naman po kayo. Opo, sabihin niyo lang po sa akin kung ano po yung mga nararamdaman niyo po. Opo, kahit ano po. Provide privacy to the patient by closing the curtains and the door. So this maintains client's dignity and lets the patient be comfortable during the procedure. I will now don non-sterile gloves to prevent microorganism transfer and exposure to patient's body fluids. I will lower the side rails and place the linen saver under the patient's buttocks. So, Miss Miley, pakibend lang po yung kaliwang tuhod. Okay, tapos hawak lang po kayo kay nurse na nasa kabilang side. And, tagilid po. May ilalagay lang po ako. Para po hindi po mabasa yung inyong kama. Yung kanang tuhod naman po, yung pakibend. And hawak po kayo sa akin. Obtain urine specimen if ordered. So this permits the removal of sterile specimens before loss of access. Ms. Smiley, bali, taas ko na po ng kaunti yung kumot nyo ha. Magsisimula na po ako. I will now insert the syringe into the balloon port to aspirate the 10 ml of fluid that is used to inflate the balloon. And after that, I will now remove the tape. Miss Smiley, relax lang po at hinga po ng mabagal at malalim habang hinihila ko po palabas ito. Okay? Okay. Then after that, hold the catheter up until the urine is completely drained to the drainage bag. After that, I will clear the bed of all equipment. Miss Smiley, tapos na po. Pwede niyo na pong ibaba yung dalawa po ninyo tuhod. Okay na po ba kayo sa posisyon nyo ngayon? Komportable po ba kayo? Okay po. So, taas ko na po yung side rails nyo para po sa safety nyo. And kung may kailangan pa po kayo, pindutin nyo lang po yung call light nyo at ako po or kahit sino mang nurse ay pupunta po sa inyo. Remove and discard the gloves in the proper receptacle and perform hand hygiene to reduce microorganism transfer. Instruct the patient to notify the nurse of the next voiding and save the urine. This allows the nurse to assess for the patient's ability to void after catheter removal. And lastly, for the documentation, the following should be noted on the client's chart. Documentation is very important. Aside from it has a legal purpose, it also lets the nurse and the other members of the healthcare team know about the current state or progress of the patient. It also facilitates continuity of care and notes how the patient tolerated the procedure. Evaluation lets the healthcare provider know if the procedure is effective or not. The removal of indwelling catheter for male patients is just the same with the removal of catheter for female patients. The only difference is, instead of being in a dorsal recumbent position, the male patient will be placed in a supine position.